Parting our dust, a new lounge gives patients a little peace before heading home. And if you have leg pain, it may not be just a symptom of getting older. These stories and more coming up next on Sinai-Grace Today. Hello, I'm Melanie Moss. Just a few weeks ago, we celebrated the hospital's $77 million renovation project. And now the transformation begins. Bulldozers, high-lows, and cranes are doing double duty, and soon you'll see the first signs of building construction.
Well, right now what you're seeing is a lot of the prep work before we start the actual building addition. A lot of the existing building utilities that currently serve the building are inside the footprint of the new building. So we need to go outside where the new building is going to be and move all those utilities out so that once we start the new building, we can cut those utilities off and the facility will still function as it currently functions. Once that is complete, which is end of April, beginning of May, we can then fence off for the new building addition, and that's when you'll first start seeing the real construction start for footings and steel coming up for the new addition.
An exciting 2 years that will require large amounts of parking patience.
Right now, you've seen the majority of the parking that changes that have happened to date are going, that's all that's going to happen at this time. We're going to see another surge of parking displacement when the building starts, about another 75 spaces in Lot A, and the ED doctor's parking lot will also be displaced. Once that is done, you won't really see any additional parking for displacement for about another year. And what is going to happen is the remainder of Lot A will be turned into the main hospital visitor parking lot and the emergency department parking lot for visitors and doctors. We are working on acquiring the old Sinai parking deck from the Detroit Public Schools, and we expect to get possession of that in 2 to 3 weeks. Once we get possession, we'll go in and restore the building to working condition, which includes lighting, emergency call boxes throughout the building, and security cameras so that employees can be in a safe environment. And it will also be manned full-time by a security officer.
From the outside in, you're going to see lots of improvements at Sinai-Grace Hospital, including our patient discharge lounge.
The discharge lounge provides an alternative place for patients to wait for their families to pick them up. It's a nice, quiet, private area, and it's a nice, refreshing change from the hospital room. So that's where we want our patients to come after getting discharged from the hospital.
Patients that will use the discharge lounge are patients that can walk, that are primary ambulatory. We do not accept patients that are going to a nursing home or patients that are on stretchers that cannot walk.
Snacks, sandwiches, a phone, and television are available for those patients who are waiting for their ride. The discharge lounge is open from 11 a.m. to 8 p.m. Monday through Friday and is located on the second floor adjacent to the west elevators. Springtime is a great time to start your outdoor walking program, but is leg pain stopping you in your tracks? These symptoms could be a sign of P.A.D. Join us on April 28th for our free People's Medical College. Our vascular experts will talk about how you can put the pep back in your step by managing your P.A.D. and even stop its progression. Registration is required by calling 313-966-4800. Tina Taylor joins us now with some P.A.D. information you'll hear on the 28th.
Peripheral arterial disease, also known as P.A.D., affects about 8 million Americans. This condition becomes more common as we get older and is dangerous because it reduces blood flow to the kidneys and limbs. And P.A.D. may also signal other circulatory problems. To learn more about P.A.D., I spoke to cardiologist Dr. Tahir Mohamed.
P.A.D. or peripheral arterial disease, it means blockages or impairment of circulation in your leg, in your neck, in your arm, or anywhere outside the heart. The patient with the P.A.D. usually they come complaining of a leg pain or what is called claudication if the P.A.D. involving the lower extremity. Claudication meaning when the patient walks, they feel severe pain in their leg. They have to sit down to relieve the pain and then they continue after that. If the P.A.D. involving the upper extremity or the hand, usually they feel severe pain when they use their hand too much. So they have to quit what they are doing and continue to do that again. Also, the patient with the P.A.D., they can have ulceration of the lower extremity. They can have hair loss as a beginning sign of the P.A.D., and they can have swelling of the feet. And they can have ulceration in their arm too.
Many people dismiss leg pain as a normal sign of aging. You may think it's just arthritis, sciatica, or stiffness from getting older. For an accurate diagnosis, consider the source of your leg pain. P.A.D. leg pain occurs in the muscles, not the joints. If you're having any kind of recurring pain, talk to your healthcare professional and describe the pain as accurately as you can. If you have any of the risk factors for P.A.D., you should talk to your healthcare professional even if you're not having symptoms.
Usually the risk factor, by far the most common risk factor is smoking, then diabetes, hypertension or high blood pressure, high cholesterol, and then a genetic or inheritance from your parent. For a patient to prevent the P.A.D., they have to stop smoking. Usually this is the first thing you should do. And then you should take care of the diabetes and high blood pressure, as well as cholesterol. And then how we diagnose it, usually they come to the physician. We did what is called ultrasound of the lower extremities or the arm. It will show up. It is very easy test, non-invasive. We don't do any needle or anything like that, which will show us the impairment of circulation. Then after that, if it showed there is a significant blockages, we'll take them to the cardiac cath, where we'll put a small balloon down their leg, will crack open the circulation, and the patient will feel much better.
There's good news for P.A.D. patients. Often you can successfully treat P.A.D. by quitting tobacco, exercising, and eating a healthy diet. As with any disease, early diagnosis and treatment are key to getting healthy. So consult your healthcare professional and take control of your risk factors. You can improve your heart health. To find a P.A.D. specialist near you, call 313-966-4800. I'm Tina Taylor for Sinai-Grace Today.
Hi, my name is Tina Brown, and I'm a patient information clerk, and I would like to know, is it true if you see someone in an accident, you should pull them out?
If someone is injured in a vehicle accident and the vehicle isn't threatened by fire or another serious hazard, then it's best to leave them where they are until emergency help comes. Even a slight move in the wrong direction can lead to paralysis or death if the victim has injured his or her spinal cord. So, should you pull a victim from a car accident? No, this myth is busted.
For these stories and more, you can visit our Facebook and YouTube pages for every episode of Sinai-Grace Today. I'm Melanie Moss. Thanks for watching.